Top 5 stroke warning signs every senior must know. This is something you'll definitely want to know, especially if you, your parents, or loved ones are in their senior years. There are 5 sudden warning signs that, if recognized in time, could make the difference between life and death in the critical first moments of a stroke. Stroke doesn't wait. It strikes fast, fiercely, and without warning. With every passing second, millions of brain cells may suffer permanent damage. Even a delay of just a few minutes can lead to lifelong disability, or worse, the person may never wake up again. In the upcoming section, you'll learn the 5 most important warning signs, symptoms that should never be ignored, along with how to respond quickly, correctly, and effectively when they appear. This isn't just useful knowledge, it could be a life-saving opportunity for you or someone you love. First sign, sudden loss of balance. Imagine your loved one is walking normally, then suddenly they stumble, have to grab onto the wall, and complain of severe dizziness, like the whole room is spinning. Never dismiss a sudden dizzy spell, even if it seems like just dizziness. The brain is sending out an SOS. So what? Many older adults experience occasional dizziness due to age, but it's the suddenness and intensity that are alarming here. Being able to tell the difference can be the line between ignoring a dangerous symptom and a life-saving action. Have you ever seen someone get suddenly dizzy and wondered what on earth to do? The most important action is call 911 immediately. I'll walk you through how to handle the situation at the end of this video. For now, let's move to the second sign, sudden vision loss. Your eyes are windows to the soul, but they can also be windows signaling a stroke. If someone suddenly complains of blurry vision, seeing double, or worse, can't see at all out of one or both eyes, like a curtain coming down, that's the sign of a vision problem. So what? Eye problems can have many causes, but when it happens suddenly and for no clear reason, especially in someone with risk factors, it's a red flag you can't ignore. Your ability to spot the difference between a common vision issue and a potential stroke sign could determine their chances of recovering their sight and brain function.
To picture this, imagine your spouse is reading the newspaper and suddenly complains the words are blurry, or they're seeing double, and it just doesn't get any better. Third sign, sudden facial drooping or numbness. Pay close attention if suddenly one side of someone's face looks like it's drooping, uneven, or they feel numbness there. When they smile, it might be lopsided, with one corner of the mouth hanging lower than the other. Sometimes drooling from one side of the mouth is also a sign. A little asymmetry in the face might not be a big deal. But when this change happens suddenly and is noticeable, that's the brain crying out for help. Asking them to try to smile isn't just a simple check, it's a crucial step for early detection. Do we often overlook small changes in a loved one's face, thinking it's probably nothing? Do you think noticing these small details can make a huge difference? Imagine you're talking to your mom or dad, and when they reply, you suddenly notice one side of their mouth doesn't seem to move as well as the other, or it looks a bit droopy in a way it didn't before. Now, imagine a conductor leading a magnificent orchestra, every gesture precise and powerful. Then, all at once, one arm goes limp, no longer obeying the brain's command. The beautiful music descends into chaos. That's a pretty good metaphor for what happens when the 4th sign of a stroke hits. That sudden, abnormal weakness or paralysis in an arm or leg. We often hear about suddenly feeling one arm, one leg, or even both on the same side of the body become incredibly weak, tingly like pins and needles, or completely numb. Maybe you're holding your phone tightly and then thud. It hits the floor without warning. Or you're walking, and one leg just seems to give out, unable to support you. It sounds simple, but behind that simplicity is a complex system under attack. The root cause often lies in a crisis within the brain, our body's ultimate command center. Think of the brain as an intricate electrical grid, where every wire, nerve cell, and every substation, brain region, has its specific job. When a high-voltage power line leading to the area controlling arm and leg movement gets short-circuited or severed, meaning the blood vessel supplying that brain region is blocked or burst, the signals just can't get through. The result? No matter how much you want to lift your arm, your brain can't effectively send that command to your muscles. And the terrifying part is, this betrayal happens suddenly, without any prior notice. Many might think arm or leg weakness is just a muscle problem, but no, this is an urgent SOS call from the brain. This leads us to a more critical question. Why are these high-voltage power lines in the brain so vulnerable? And are we all facing this risk equally? Or are there silent factors increasing the chances of a power surge in some people's brains? Recognizing this sign early, like that image of a friend dropping their coffee cup, can literally save a life, or at least minimize devastating after effects. But just recognizing it isn't enough. We need to go further, to dig deeper into how to maintain this delicate network of blood vessels in our brain. Because, here's a truth few might suspect, the health of our brain's blood vessels is intimately linked to the seemingly ordinary choices we make every single day. One of the most dangerous hidden enemies is high blood pressure. Imagine your brain's blood vessels are like delicate water pipes. High blood pressure is like constantly cranking up the water pressure in those pipes to the max. Initially, they might handle it, but day after day, that relentless pressure wears them down, making them brittle and prone to bursting or creating conditions for gunk, plaque to build up, narrowing the pipes. The kicker is, many people live with high blood pressure completely unaware, because it often shows no clear symptoms until it's far too late. This is the loop of indifference. We don't see symptoms, so we don't get checked. We don't get checked, so we don't know there's a problem, and when the problem explodes into a stroke, things can already be dire.
Fifth sign, sudden trouble speaking or slurred speech. Picture this. You're in a lively conversation, ideas flowing, and then all of a sudden, your tongue feels tied. Familiar words suddenly seem foreign, or you just can't get them out, even though you know exactly what you want to say. This isn't just a normal moment of forgetfulness. This could be a red alert from your brain, signaling a sudden assault on your ability to communicate, a sign of a stroke. We often hear descriptions of someone suddenly stuttering, slurring their words, using bizarrely wrong words, or even being unable to speak at all or understand what others are saying. Many people might wave it off thinking, "Oh, they're just tired," or "it's just old age." But that's a potentially fatal mistake. That kind of casual dismissal can rob someone of the golden hour to save their brain. The fact that you notice something odd about someone's speech and act immediately by calling 911 can determine whether they regain their ability to communicate, whether they can return to a normal life. A simple test like asking them to repeat, "The sky is blue today," isn't a joke. It's a quick and effective screening tool. If they struggle, don't hesitate. But again, just knowing how to fight the fire isn't enough. We need to be smart fire preventers. Many people don't realize that our everyday choices are silently either poisoning or nourishing our brains. Consider a dirty diet. Every greasy fast food meal, every sugary soda isn't just affecting your waistline, but is also suffocating the blood vessels in your brain. These toxins increase the risk of plaque buildup, leading to blockages, a direct enemy of the brain cells responsible for language. Similarly, a sedentary lifestyle, characterized by sitting for hours in front of a screen with little movement, doesn't just make your body sluggish, it also makes blood flow to the brain less efficient. Your brain needs exercise too, through your body's movement, to get enough oxygen and nutrients. And then there's your companion called stress. Modern life is full of pressure, and chronic stress doesn't just make you tired, it triggers a cascade of chemical reactions in your body, increasing blood pressure and negatively impacting your blood vessels. Is hugging your stress unknowingly strangling your future ability to communicate?
It's always better to prevent illness than to treat it. Bottom line, here's the best thing to do if you or someone else experiences a stroke. Call 911 immediately. Remember, time is brain. Every minute delayed means millions of precious brain cells are dying and cannot be recovered. Never hesitate. Why call 911 instead of driving them yourself? Because paramedics on the ambulance can start treatment right away, know which hospital has a dedicated stroke center, and can notify the hospital in advance so they're ready, saving critical time. Driving yourself is slower and unsafe for the patient. One helpful thing you should do is try to remember when the symptoms started. This information is vital for doctors to decide on the best treatment. What about mini strokes or TIAs, transient ischemic attacks? Even if the symptoms disappear after a few minutes or hours, a TIA is an extremely serious warning sign of a major stroke to come. Even if the symptoms are gone, always treat a TIA as an emergency and call a 911 immediately. Don't be complacent. While waiting for the ambulance, you can help the person with a few simple things. First, try to stay calm and reassure them. Your panic can make the situation more stressful. Next, help them into a safe, comfortable position. If they're conscious, have them lie down with their head and shoulders slightly elevated. If they seem nauseous or have trouble swallowing, gently turn them onto their side to prevent choking. Extremely important note: absolutely do not give the person anything to eat or drink or any medication, including aspirin, unless specifically instructed by 911 dispatch. This could do more harm. Continue to observe the person, noting any changes in their symptoms and the time the symptoms began, if not already clear. Finally, get ready for EMS to arrive. Unlock the door, clear a path. If readily available, have a list of the person's current medications. Keep watching our videos to learn more about the signs and prevention of stroke.